Hi, friends. Regardless of what you see, I'm actually doing much, much better. Um, what I didn't show you in my last two videos, especially when you saw my face, is that on the right side of my neck, it was very swollen and it hurt. It was really bad. Hang on, I'll show you a picture of what it looked like by the time I went to the hospital. Okay, this is pretty gross. If you are squeamish, don't look at this. Ready? All right, fair warning. This is what my neck looked like. You can see it was extremely swollen. Up into my cheek was swollen, up past my ear. It was swollen almost to the other side of my chin. It was swollen down there, right there. And then it started to weep fluid. So what happened was I went to a walk-in clinic with my husband, and they said no, I needed IV antibiotics and sent me across the street to a hospital. At that hospital in the ER, they brought me back pretty quickly and did a bunch of cultures with my blood, and we sat there and waited and waited. I did a CT scan. The CT scan showed that it was a mass of some kind. They thought it was either it was possibly cancerous, it was possibly necrotic, meaning it might have been a dead lymph node, or that I had an abscess of some kind in my neck. The doctor that I needed to see was not at that hospital, though. He was at a sister hospital about 25 or so minutes away. And so that's where I've been ever since. So they transported me here via ambulance. I got into my room at this hospital at 12:30 Sunday night, and I've been here ever since. And now it's about 6:45. I think I said that before, but I'm not sure because I tried to record this part and forgot to hit record. I had surgery yesterday morning. Well, let me back up a little bit. The doctor came to see me on Monday morning, or Monday afternoon rather, and did a biopsy to find out what it was. And unfortunately, he wasn't able to use any numbing agents or any anesthesia for the biopsy, so it hurt pretty bad, but I got through it. And it was really necessary, so sometimes you have to do the really hard things, you know what I mean? It started getting a bit worse, quite a bit worse, and so I've had something wrapped around my neck for a couple of days. This is here because I had surgery yesterday. I went down to the OR. They had to put me under general anesthesia, but luckily it was a relatively short procedure. They had to drain the abscess. They figured out that it was an abscess, and I've had a massive infection in my neck. They drained it, they packed it, so it's not sutured. I don't have nice stitches. It's going to heal from the inside out. And what they do when they pack it is some of the packing comes out like an inch at a time, like an inch a day. And you do that until it's healed. I'm not looking forward to that part, but again, you have to do the hard things sometimes. And this is one of those times. Anyway, I have an excellent prognosis, meaning that once I leave, I have an excellent chance of everything healing. And I'm really grateful for some of my doctors here who have really stood up for me. And I've hit some road bumps with my medications, because when you're a cancer patient, you're not just medically fragile, you're also extremely complicated. And you have medications, you have things on a schedule. And when you go to the hospital, sometimes you don't even get all of those medications, and you definitely don't get things on your schedule. That makes it really, really difficult. I'd also like to thank my nurses who have done their best under hard circumstances. Sorry, my hair, I'm a mess. But I'm really sorry. I just look awful, but I'm feeling better, and that's the important part. But yeah, my nurses have done their best under difficult circumstances, and I really appreciate that too. Most of all, I want to thank my family because they're the ones who've really been hit hard, and I want to thank some friends that I have. I have 5 friends on Discord that have walked me through some of what I needed to do and what I need to ask and what I need to do when I leave here about a couple of situations that I had. And they're invaluable friends. I have not let most of my local friends know about what's going on simply because I just have been exhausted, and I I didn't want to go through having to explain it very much yet, and I will as I get better. Anyway, friends, that's it. That's the long and short of what's going on. And, a couple of videos ago when I said I wasn't feeling well, I was really in a lot of pain. A lot of pain. And that's really not fun. I made the video to sort of take my mind off of what was going on. And I did my nails, and that was a lot of fun, and it did kind of take my mind off of things. Believe it or not, I've gotten so many compliments on them since I've been here, so I'm glad I took the time to do that. Other than that, that's it. I love you, friends. I really hope you're doing well. I really hope that what you're going through is fixable, and if it's not, that you're at least comfortable. All right, that's really it. I love you. I'll talk to you soon. Bye, friends. I know I said goodbye, but I forgot to mention that I've been on some really heavy duty drugs. Obviously, I'm on oxygen. I'm on several extremely high level antibiotics, among other things. And that's why, my port is accessed. I'm on a heart monitor because my blood pressure has been extremely low while I've been here, and that's caused some problems. But everything else is okay. It's going to be okay, friends. So I just wanted to reassure you. I know there's a lot going on, but everything is okay, my friends. I love you. Bye.